If your circulation is sluggish, chances are you have already burned through bottle after bottle of supplements without feeling any real change. The truth is, most of those pills are just expensive filler, and your blood vessels are still crying out for help. What your body actually needs comes down to just 3 targeted high-impact nutrients that can relax and reopen those tight, narrowed vessels in your legs. Forget generic multivitamins. Their doses of the key ingredients for vascular health are so low that you might as well pour them straight down the sink. In this video, I am going to strip away the marketing hype and focus only on the 3 vitamins that truly matter for transforming leg circulation. I will walk you through the exact forms and dosages that have been shown to work, and I want you to listen closely when we get to the 3rd one, because it is a complete game changer only if you take it at a very specific time of day. Get that timing wrong and you will not get the benefits. Vitamin number 1, niacin vitamin B3, the cleanup crew. We begin with the base of the entire protocol, the body's internal scrub brush. This first vitamin earns the name Cleanup Crew because it targets the 2 core drivers of poor circulation: at once narrowed vessels and thick, sticky blood. When arteries tighten and your blood becomes more viscous, flow slows to a crawl. Your feet turn cold, your legs feel like lead, and your circulation feels more like a slow drip than a strong current. Niacin goes straight at this problem. It is a true essential, but only when you use the right form at the right dose. The active compound is niacin vitamin B3. The tiny traces hiding in most multivitamins do almost nothing for circulation. What you need here is a therapeutic amount and the correct version. For circulation, you must choose the flushing form of niacin, also called nicotinic acid. This is where both the benefit and the brief discomfort appear. That warm red flush is actually the sign that niacin is powerfully opening up the small blood vessels and capillaries in your skin. Non-flushing types such as inositol hexanicotinate are popular because they avoid that sensation. But when it comes to rapidly improving circulation and supporting healthier blood fats, they simply do not create the same strong vessel widening effect. If you want real noticeable change, you need to be willing to accept the flush. Start gently. A compound this strong must be respected. Begin with 250 mg once a day taken with food to soften the initial flushing response. After about 2 weeks, if you handle the flush comfortably, you can increase to 500 mg once daily, which is an effective circulation support dose for many adults. Never push the dose higher or adjust it further without speaking with your doctor first, especially if you have liver issues or take prescription medications. The flush itself feels like warmth, redness, and sometimes mild itching across areas like the face, neck, and chest, usually lasting only 15 to 30 minutes. Some people find that taking a non-aspirin anti-inflammatory about half an hour before their niacin helps take the edge off. But the most important factor is simply consistency. Over a few weeks, your body typically adapts, and the flush becomes much less intense. Why does this vitamin work so well for cold, tired legs and feet? Niacin uses a double action that directly upgrades blood flow. First, it acts as a natural vasodilator, meaning it relaxes and widens blood vessels. The flushing form of niacin triggers the release of signaling molecules that tell the muscular walls of arteries and arterioles to loosen. Picture driving on a 4-lane highway instead of a narrow back road. Vasodilation turns that cramped 2-lane path into a wider route, so the same amount of blood can move faster and with less strain, which is crucial for getting warmth and oxygen all the way out to your hands and toes. Second, niacin helps change the character of your blood itself. It is well known for improving the thick and sticky components in the bloodstream, making the blood less viscous, so it glides more smoothly through those newly opened vessels and reduces the force your heart has to generate with each beat. Less stickiness and more glide is exactly what you want when you are trying to get rid of that heavy dragging sensation in your legs. In short, niacin B3 truly acts like an internal cleaner, widening the channels and helping the blood slip through with less resistance. Use the flushing form, follow the 250 mg 500 ml plan under medical guidance, and you have built a powerful first pillar for better circulation. But even when the pipes are cleaner and wider, they can still become stiff and lose their spring. That is why the next nutrient is all about restoring flexibility, the flexibility fixer. Vitamin number 2, K2MK7, the flexibility fixer. Picture a new rubber hose that bends easily and handles pressure without effort. Then compare it to an old stiff plastic pipe that cracks and barely lets water through. With age and poor diet, your blood vessels can shift from that supple hose to the rigid pipe. This loss of flexibility is devastating for healthy circulation. Vitamin K2 is the second key nutrient, and its job is to help restore that youthful elastic quality to your arteries. Here the exact form matters. You cannot swap K1 for K2. You need vitamin K2 in the MK7 form, often written as menaquinone 7, or MK7, not the K1 found in leafy greens. K1 mainly supports clotting, while K2 uniquely targets soft tissues and vessel walls. MK7 is especially valuable because it stays in your bloodstream for many hours, working steadily throughout the day. The effective daily range for vessel support is roughly 100 to 300 micrograms, not milligrams. So always double check that the label lists K2 MK7 in this microgram range. K2 occurs naturally in fermented foods, especially natto, the traditional Japanese fermented soybean dish. Since many people find natto difficult to eat, a supplement is often the easiest way to reach a therapeutic dose. Because K2 is fat-soluble, it is best taken with a meal that includes some healthy fat to boost absorption. K2's most powerful role is as your calcium traffic controller. Calcium is only helpful when it is in the right place, like bones and teeth. With aging and modern eating patterns, calcium can start drifting into soft tissues, including your artery walls, where it behaves like cement inside a rubber hose. This process, called arterial stiffness, makes vessels hard and flexible and very unfriendly to smooth blood flow. Vitamin K2 solves this by activating a protein called matrix GLA protein, or MGP. Once switched on by K2, MGP acts like countless tiny vacuums moving through your bloodstream. They hunt down misplaced calcium in the artery walls, bind to it, and help pull it out of the soft tissue, sending it back toward the bones where it belongs. As these deposits are cleared, your arteries regain softness, flexibility, and the ability to adapt to changes in pressure. That means smoother regulation of blood pressure and, most importantly, easier flow to heavy, tired legs. In short, vitamin K2 MK7 is your flexibility fixer, helping keep vessels soft and resilient by removing hardening calcium from the wrong places. Take 100 to 300 micrograms of the long-acting MK7 form daily with food. At this point, we have cleaned the pipes and helped them stay flexible. The final step is adding a powerful signal that tells those vessels to stay open and perform at their best, which leads us to the opening signal, vitamin number 3, vitamin C, the opening signal. We have handled structure and flow. Now we move to the command system. The third vitamin is the raw material your body needs to create its most powerful signal for instant vessel relaxation. Without enough of it, you simply cannot produce sufficient amounts of this open up now message, so your arteries stay tighter than they should. That is why I call vitamin C the opening signal, and with this one timing is absolutely crucial. Everyone has heard of vitamin C, but very few people realize how deeply it supports vascular health, far beyond its reputation for immune support. For circulation, higher doses are needed, and plain ascorbic acid can irritate the stomach. That is why a buffered vitamin C combined with minerals like calcium or magnesium, or a liposomal vitamin C, is ideal. Liposomal C is wrapped in tiny fat droplets, making it gentle on the gut and extremely well absorbed. To meaningfully drive the vessel opening process, aim for 1,000 milliliters from 1 gram once or twice daily, so that enough vitamin C is circulating to support the entire vascular network. On the inside, vitamin C is a key guardian of the endothelial cells, the thin lining that coats every blood vessel. These cells produce nitric oxide, or NO, the body's most potent natural vasodilator. Nitric oxide is the master relaxer, sending the message that tells vessel walls to widen and allow blood to move more freely. Vitamin C not only helps these cells make NO, it also shields nitric oxide from being broken down too quickly by free radicals. In other words, it stabilizes the opening signal so it lasts longer and works more effectively. Think of vitamin C as the essential fuel that keeps the relax and open engine running. Now, for the timing detail that makes or breaks your results. You should take vitamin C in the morning, and if you are using a second dose, by early or mid-afternoon. First, higher doses of C can feel mildly stimulating, for some people almost like a gentle energy lift. Taking it too close to bedtime can interfere with sleep, which is already fragile for many older adults. Second, your need for nitric oxide is highest during the day when you are on your feet, walking, climbing stairs, and asking your legs and muscles to work. By front-loading your vitamin C, you give your vessels the strongest opening support when demand is greatest. A simple rule of thumb is this: 1,000 milligrams with breakfast, and if desired, another 1,000 milligrams with lunch or an early afternoon snack, and avoid doses after about 5 p.m. Vitamin C, the opening signal, is the vital fuel for nitric oxide, the master relaxer that widens your vessels on command. Use 1,000 milligrams of a buffered or liposomal form and keep your doses earlier in the day. Alongside niacin and vitamin K2, it completes a powerful 3-part strategy for healthier circulation. Now that you know the 3 key nutrients, it is important to avoid common traps and make sure you are using them safely and intelligently. First, the big myth: I take a multivitamin, so I am covered. In reality, most multivitamins only include enough to prevent deficiency, not enough to create therapeutic change. A typical formula might give you around 20 milligrams of niacin when you really need 250 to 500 milligrams for circulation. It may include 5 micrograms of vitamin K, usually K1, while you need 100 to 300 micrograms of vitamin K2, MK7. Vitamin C is often around 60 milligrams, but for vascular support, you are aiming for 1,000 to 2,000 milligrams. To feel a real difference in blood flow, these 3 must be taken separately at the higher targeted doses. Safety always comes first. With niacin B3, higher doses are very powerful and can interact with medications. In some people, they may influence liver enzymes. If you have liver disease, diabetes, or take blood pressure or cholesterol drugs, talk with your doctor before using therapeutic niacin. Your physician may choose to monitor liver function while you are on it. Vitamin K2 also requires care because it is involved in clotting pathways. If you are on blood thinners or any anticoagulant, you must clear K2 with your prescribing doctor before starting. They may need to adjust your drug dose or check your blood more often. Vitamin C is generally very safe, but large doses can upset the stomach in some people. Using buffered or liposomal forms and drinking plenty of water usually reduces this problem. You are not chasing a magic pill. You are giving your body tools to rebuild what time and lifestyle have worn down. That means commitment. In the first 1 to 7 days, the main thing you will feel is the niacin flush. You may also notice brief warmth in your hands and feet as vessels begin to open. Your focus in this phase is simply getting used to the routine and staying consistent. From weeks 2 to 6, the widening effect becomes more reliable. Your legs may feel less heavy in the evening, and the niacin plus vitamin C combination starts to show in better color and warmth in your feet and lower legs. This is a subtle but noticeable shift. After about 3 months and beyond, the deeper work of vitamin K2 begins to stand out. As stiffness gradually eases in the arteries, circulation becomes steadier, less vulnerable to sudden dips, and more efficient at returning blood to the heart. This is where the most dramatic lasting improvements appear. Remember, these are nutrients, not drugs. They support and repair natural systems, and that process takes time. Missing doses, especially of K2, interrupts the steady presence your body needs to keep making progress. Build a simple daily ritual, taking your supplements at the same times every day, and let consistency do the heavy lifting for your circulation. You now have a clear, focused roadmap. No more wasting money on scattered multi-blends that barely move the needle. Instead, you are working with 3 precise high-dose nutrients aimed directly at better blood flow. Niacin B3 in its flushing form acts as the cleanup crew, quickly widening your blood vessels. The effective range is 250 to 500 milligauss daily, and you must be prepared for the flushing sensation that comes with it. Vitamin K2 MK7 is your flexibility fixer, helping to pull hardening calcium out of artery walls and support softer, more elastic vessels. The helpful daily window is 100 to 300 micrograms, but if you are on blood thinners, this one must be cleared with your doctor before you begin. Vitamin C, ideally buffered or liposomal, serves as the opening signal by fueling nitric oxide, the master relaxer that tells vessels to widen. You are aiming for 1,000 to 2,000 milligauss per day, taken before 5 p.m., so it supports you during your most active hours without disturbing sleep. Now, it is time to turn information into action. Your circulation should not be an afterthought. This is about lighter legs, warmer feet, and the energy to fully enjoy your later years. Give this protocol a fair trial. Commit to 90 days of consistent use and let the combined power of niacin K2 and vitamin C show you what more efficient, better supported circulation can feel like.